Hi everyone, we're now going to look at the movements of the glenohumeral joint, as well as the movements of the elbow. Let's start with the glenohumeral joint. The glenohumeral joint, as you'll remember, is a ball and socket joint, capable of movements in 3 planes. That's 2 movements in every plane, so 6 movements. Let's start with the movement of flexion. We're looking here at the scapula, as well as the humerus, and the movement of flexion is to bring the humerus in an anterior direction or forward. Technically it goes 90 degrees, but commonly referred to as its full movement of 180 degrees. Returning back to the anatomical position is extension, and then the movement backwards of your humerus is hyperextension. The movement into the frontal plane is abduction away from your side, and then adduction returning back. The glenohumeral joint is also capable of internal rotation and external rotation. Internal rotation is also known as medial rotation, and external rotation known as lateral rotation. We're now going to look at the movements of the elbow. The elbow is a relatively complex joint consisting of the distal end of the humerus, where we have a couple of condyles, as well as the movements where the proximal ulna and the proximal radius articulate. Let's first of all look at flexion. Flexion is decreasing a joint angle at the elbow, approximately 145 degrees, and extension returning the elbow back to 0. Notice that in flexion and extension, both the radius and the ulna articulate at the distal end of the humerus. In the movement of pronation, which is going palm facing down, as well as supination, palm coming back up, face up. This is a movement that occurs at the proximal and distal radio-ulnar joints. We can see at the proximal radio-ulnar joint the movement of the radius as it rolls both on the ulna and the distal humerus into pronation. Also notice that the bones cross over. That's the radius crossing over the ulna in pronation and then returning back to parallel with the ulna in supination. Those are the movements of the glenohumeral joint, the humero-ulnar joint, the humero-radial joint, as well as the radio-ulnar joints.